Bom dia. Healthcare in the U.S. is a racket. If you're from the USA, you're told that the healthcare is the best in the world. You think that the people who live in countries with public healthcare programs through the government get low-quality care and terrible facilities. These teachings couldn't be further from the truth. In the U.S., people go bankrupt every day trying to pay for healthcare, end up losing everything they own, and having to move in with family to make ends meet. It'll be fun. Vai ser divertido. If you are new to our channel, I am Alan. Been here a while? I'm Alan. I'm here with my wife Leslie, our son Wolf, our dog Greer, and Rex the cat. We are from the United States and now live in Portugal on the beautiful Island of Madeira. Thanks for being here. Please like, subscribe, and hit the bell. We tend to talk about healthcare a lot, and we actually have a very good reason for it. Leslie's parents both worked all of their lives. Hard work meant saving for the future, finding time to be loving parents, and believing in education. They met when they were just 14 years old and were married over 60 years before her mother passed away. Her mother, Jan, was a very successful woman with her own business. Jan's health started failing in her 50s, which caused the price of insurance to go up fast. Because they owned their own small business, insurance was off the charts expensive, thousands of dollars a month. Ultimately, in their 60s, they closed the business and got jobs just to get health insurance. By the time they could qualify for Medicare, the majority of the money that they had saved during their lives was gone. So you think, well, they now qualify for Medicare and everything will be okay. That's not the way it works. If you have health issues, you need to purchase the Medicare program, the Medigap program, and the prescription program, which for Jan meant the cost was all of her Social Security. And since most of the savings had gone to pay previous medical bills, almost nothing was left to live on. But they still have my father-in-law's Social Security. However, due to the health issues, they fell in the prescription donut hole every year, which means that an additional $5,000 has to be paid in cash before you get any prescription coverage. Again, leaving them with almost nothing to live on. So eventually they had to move in with family and rely on the largesse of someone else. After watching this happen in the U.S., we understand more than most why one should focus on healthcare. This takes us to our discussion on healthcare here in Portugal. We joined a group of about 75 people for the 7th annual Route of the Cherry Blossoms Walk in the parish of Jardim de Serra. This walk is hosted by the Sociocultural and Agroforest Development and Innovation Center. The blooming trees were spectacular. We finally found a town where ornamental and flowering gardens were the norm, reminding us of Crystal Lake, Illinois. The walk went up and down through 2 valleys, taking us a short 3.5 kilometers that took over 3 hours to walk. We are here with Alana and Art from Kitimat, Canada, and the YouTube channel Let's Go. We're viewer supported. If you enjoy our videos, we invite you to join our Patreon community. Portugal has a public and private healthcare system. Let's first discuss the public system. It's paid for through the taxes that you pay on your everyday purchases. The public system covers primary care, secondary care, and tertiary care. Primary care means things like seeing a doctor when you have a cold and covering your prescriptions. Secondary care allows you to receive care for things like dermatology, visits to an OBGYN, etc. And tertiary care is hospitalization. This care covers you if you have a heart attack, cancer, or need a liver transplant. Yes, there are small copays for your visits in the public system, but by small, we mean really small, like under $20 for most things. The public system also covers drug addiction care, cancer treatment, and helps to cover nursing home care as you age. Amazing. What's the catch? Well, that would be the wait times for care. You don't have an assigned general practitioner, so you schedule your appointment and take the doctor that is available. We've discovered that the wait time for primary care doesn't really take all that long. Most people get an appointment within a few days, or if they need immediate care, that could be done as well at the local health center or public hospital. The wait times can become an issue when you need to see a specialist or if you need aftercare. These appointments can take up to 3 months to get. A dermatologist can take up to a year to get an appointment. So if you receive all this care, why would you want to pay for private health insurance? The main benefit of private health insurance is easy access to the services you need or want. Both systems actually use the same doctors, which is perfect. Why? Because if you need to see your cardiologist or have a torn meniscus repaired, you can do this easily without waiting in the public system. Same for your follow-up care with your OBGYN, oncologist, and endocrinologist, for example. In the private system, you get to choose the doctor you would like to see and therefore build a relationship with them. By the way, when you have an appointment with a doctor, it actually lasts for a good 30 minutes with the doctor. Not sitting in the room by yourself and waiting for them to run in for 3 or 4 minutes. Our private health insurance covers us as we age, covers pre-existing medical conditions, has small copays, and a €250 deductible. Score. This level of coverage is actually affordable. We pay under $300 for a family policy per month. The best day of your life is the one on which you decide your life is your own. No apologies or excuses. No one to rely on or blame. The gift is yours. It's an amazing journey, and you alone are responsible for the quality of it. Bob Moawad. So let's touch on how to shop for your health coverage. You'll find health insurance policies and health plan discount programs available. There's a big difference between these two. Most people in the U.S. understand this already. However, just for clarification, a discount plan is just that. It's not insurance. It offers you discounts when you go to the private hospitals. Health insurance actually covers you based upon the policy that you have chosen. The large insurance companies in Portugal are Fidelidade, Amgen, which we use because they cover pre-existing conditions, Alliance, and Metis. Your overall cost will be about 90% less than in the U.S. By the way, did you know that Portugal ranks number 12th in healthcare, while the U.S. ranks 37th, according to the World Health Organization? When shopping for your health insurance, remember that you are your best advocate. Take a look at more than one option so you understand the market coverage and the pricing. For example, here in Portugal, the banks offer you an insurance plan, and while it is convenient, we do think you should explore your options with an independent insurance company before you purchase. Many plans do not cover you as you age. They may drop you once you hit 65, or the price goes up and becomes unaffordable. Many plans do not cover pre-existing conditions, so you need to ask the right questions and truly understand what you are purchasing. If you want more healthcare information, please look at our other videos. We will link them at the end of this video. Please give us your thoughts in the comments below. Let us know what we can help you with. For example, planning your journey from the scouting trip through getting settled in Madeira. Join us on Patreon, where we will help you with an if, connect you with a trusted real estate agent, immigration team, tax attorney, etc. The description of our videos holds links to our Patreon, planning a one-to-one call, and affiliates. We hope you continue to come along with us on our new adventure. Life is short. We should have done this sooner. Please like, subscribe, and hit the notification bell to help us grow. The next stage in your life is a journey. Enjoy it.